Hi, my name's Steve Hodgson. I'm Director of Hallamshire Physiotherapy and Physiotherapist in Broomhill in Sheffield. This is the start of a series of regular videos we're going to make about the clinic and discussing some of the more common problems we see and what we could do about them. And this is something that we've been requested to do. So the first thing we're going to talk today about is trochanteric bursitis. Trochanteric bursitis, the trochanter is the area on your hip, and bursa or bursitis is an inflammation of a sac of fluid which sits on the outside of the hip and covers between the bone and the muscle. You see these things that become acutely painful on movement and loading, often being injected, which has variable results. Some people have been for 2 or 3 injections and found it didn't really work. As a general rule, when you look at these things, that there's usually some underlying problem. It could be lack of hip control, or it's a referral pattern from the spine. Rarely, in my experience, is it just purely bursitis. I think it's one of these things that is often diagnosed, but in reality, I'm not convinced it exists. So certainly, there's no signs of inflammation when you examine most of these people. And as you start to use their back and show them what they're doing wrong, and which could be changing gait pattern in a runner, or how people move and how they generally move their bodies, you often make significant improvements relatively early. So if you do get trochanteric bursitis and you are struggling, getting it assessed by a physiotherapy and try and look at the root cause of it. Do not just think of it as a local problem. There's usually some underlying problem, and if you can fix that, which is often quite relatively straightforward, you can make significant improvements to it.